Hello, everyone, and welcome to another episode of the Cycle Podcast. I'm very excited today because our guest is so far away from me, but we connected over social media, and I've honestly always wanted someone to come on from Ireland because I've actually talked to a lot of people from Ireland, and there is a lack of care in Ireland for patients with endometriosis. But Elva is our guest today. She is the most lovely soul, and I'm so grateful to know her, and I look forward to sharing her story with you. And thank you so much for being here today.
Thank you. My God, really exciting.
Yes. So we look forward to kind of digging into your journey so far with Endo. But why don't, before we get into that, just tell us a little bit about yourself and where you are in Ireland and when we can come visit you, because that's on my list.
Yeah, well, no one can come visit us right now because we're all locked away, but you're very welcome. So when you do come to visit me, I'm in a county which is called Kildare. It's kind of the east coast, so I'd be about, let's say, half an hour, 40 minutes from Dublin. And I live here. I was in the UK for many years, for 9-10 years until recently, and then I returned home. So I'm home closer to my family. The family are nearby, and then I'm married to Connor, who is upstairs working away, and we have a lovely rescue dog called Obi, who is, I don't know, snoring somewhere. So yeah, this is where we are. We like I said, came back about 2 years ago, and yeah, loads of big life changes, and coming back to your own country when it's changed lots over the years, but kind of just about settled in, and then more life changes, which is why I'm talking to you.
Yes. Okay. Well, then let's just dive right into your story too. So do you remember when you first started your period, and was it painful when you first had it?
Yes. So I was, and again, it's so interesting when I listen to loads of your podcasts and stuff, and the ages, and it varies so much. I think I was quite young. I was 11, not far off turning 12. And I remember being really excited. I thought it was really cool. But I remember it being bigger than I would have thought. I remember it was heavier. I even remember the day I kind of, show your mom and think, is this my period? And my mom being like, oh God, yeah, that definitely is. So yeah. I would have always been a heavy bleeder and a long bleeder. I've never known a period less than a week. I didn't realize that people can have their period for 4 days. Pain, yeah, actually my teen years, I would say, were the most painful period time. I remember just a lot of burning pain, like being on fire, hips on fire, legs on fire, groin on fire. But again, my mom's the best in the world, but she and one of her sisters had full hysterectomies in their 40s. They would have been heavy bleeders, but no known family history of endo. My grandmother on her side died, unfortunately, of uterine cancer, but I think it was just 70s, late diagnosis. I don't think there's any huge link, but we're a family of heavy bleeders. So I was definitely brought up to know that it's normal. It's normal to bleed heavily. It's normal to take painkillers. It's normal to suffer. That was my journey.
Right. So you thought it was normal because your mom thought it was normal, and her sister thought it was normal, and your grandmother thought it was normal, because that's just, the lack of awareness with endo. So you said burning pain. Did you ever, and this went through your teens, was there a point like between 11 years old and being a teen or in high school that things got really bad, or that you started to say like something isn't right, or you just learned to deal with it?
Yeah, well, I think I just learned to deal with it. And I probably didn't talk to my friends as much as I would encourage, say, younger, ladies now to do. Because again, we all talk about our periods and it being uncomfortable. I did then, when I was 17, I had a pretty bad, I can't really remember, to be honestly, I've thought about this in preparation. I can't remember what happened on the day, but I was in a heap for some reason. And my mum's gynae at the time saw me kind of as an emergency, and he did an ultrasound, a TV and a pelvic, and was like, there's something big on your ovary. I need you to come in urgently. And again, when you're younger, you're more just worried about kind of surgery. I didn't realize afterwards that like they could have been concerned about something like, a malignant tumor. So I went in and had at 17 laparoscopy. But he went in obviously just literally looking for this. And what he came out with and said was you had what was a dermoid ovarian cyst, no big damage done, a little bit of my ovary removed, but no mention of anything else. Mention of PCOS, probably to put down to like why you have heavy periods. And he kind of said, you know, your mom was this way, maybe you'll need a D&C when you're a bit older, but nothing else to worry about. And so I guess I kind of felt, well, someone had been inside me, they found a cyst, but there was nothing else there.
Right.
I kind of find it hard to think that there wasn't endo going on now that I've learned so much, but was it that he didn't see it? Was it that he was a professor, he was highly regarded, but it wasn't his specialty? No, we don't know. But I did out of that, and I was put on the combined contraceptive pill.
That was going to be my next question. What was his treatment plan after? Do you think by chance that may have been a endometrioma instead of yeah.
Who knows? I mean, and again,
I guess we can't speculate because we don't know, but.
Coming after surgery, or maybe the day after, whatever, to kind of discharge you, and he just said to my mom and dad, and there's nothing sinister there, and my mom being really kind of a little bit upset, and I was kind of like, what are you crying about? And she, for the first time, acknowledged that like that could have been cancer or something. And I was kind of thinking, Jesus, I just thought like a cyst. But yeah, he just said it was probably a dermoid, so I don't know if it actually went away for.
Right. Of course.
But I went on the combined pill, and I stayed on that until I was 26. And I don't think it ever really did anything for me. It certainly regulated my cycle, but I think I've said to you before, I thought that the deal with the pill was that you'd have your period, but you had to take it for those first few days again to stop the bleeding.
Yeah.
Because that was what I had to do. I still had really long periods on it. And then, in my late teens, I became quite a bad anxiety sufferer. And I think just, the pill and hormones just never helped that for me.
No.
Early 20s. But
yeah. Did you still have pain? Did you still have that like burning pain with the pill? Yeah. So the only thing it really did for you is regulate your period.
Yeah, definitely. It just gave me as well that plan. I know when my period's coming, I can go on holidays, I can do this, I can do that. But that's all it really did for me, hormones wise. So
did you go off the pill at 26?
Yeah, and I think in those in between years until 26, nothing massively changed. I think some things now that I realize kind of crept in, but again, you kind of play them off. So I definitely, in my early 20s, I remember going to my GP. I was still living in Ireland at the time, and I remember going to him with, and again, really embarrassing. They're kind of like, I think I was there for another reason. I was like, by the way, I get this incredible pain in my bum. Like someone has taken a knife and is stabbing me in the bum and in my vagina. And really nice GP, family GP for as long since I was born. And he was like, this is a thing called proctalgia. It's like the nerves in your anus or your rectum, and it's really normal, and don't worry about it. And you can do a massage, and I just, again, because someone was like, this is normal, you just go away going, it's just something I get. That was the kind of addition in my early 20s until I kind of got to the age 26. And then I was in the UK at this point, age 26, and I just was done with the hormones. But I still wanted contraception, and it was offered to me, but they kind of said, you can have the copper non-hormonal one of these. And it goes in for 10 years and you don't need to think about it. And I had it and it worked. But everything I suffered from then until December just gone, I always put down to, it's just this coil. It's great for contraception, but it's a thing that's inside you. So it's probably irritating things, and every other symptom I put down to the coil. And everyone supports me with that. Every GP would have said, yeah, that probably is your coil.
Of course. Yeah. I'm sorry. So going back, going back to when you had the pain in your bum and your vagina, did that continue throughout this time, through like the 17 to 26, and then even when you had the coil, did you still have that pain? And then was it on your period, or was it all the time?
Really bad coming up to my period, and then just kind of any time. And that's why, again, because it would happen non-period, you don't associate it with,
of course,
menstrual.
Right.
Well, I would get it, and it still does this. I will get these spasms that wake you from your sleep.
Yeah.
You feel like you're just going to throw up, or it can stop you, and like you'd be talking to someone and grabbing the desk.
Yes.
But that was still, that never changed. But what added to that was really, really bad pain with having sex.
Yeah.
And that was when I started, when things started getting involved in terms of sexual activity, was when I started getting spun around the houses. And the other thing, and if there's anybody out there listening in the UK, and I'm sure there's loads of them, they'll be aware that when you change where you're living, unless it's within like a couple of streets or certainly within a small area, you have to change your GP with the NHS. Or at least that certainly was all 9 years I was there. Maybe it's changed in the last 2 years. But so if you move like even across the other side of London, you have to change your GP. You can't keep your doctors. And that just won't help anyone with endometriosis.
No.
Because you're logging everything. And they say that they transfer the notes, but do they, don't they? And so I went from Billy to Jack between the addition and on top of this with really bad vaginal dryness, really, really bad pain with sex, the rectal pain, that kind of groin pain. My periods were getting way longer. They'd be like 9, 10, 11 days. I'd have a really long cycle of 5, 6 weeks between them. And then I could go a few months where I'd get like a 10, 12-day break between cycles. I don't even know how that works with your ovaries, how you're having a bleed finish and start again 10 days later, but it would happen. And then I would have mid-month bleeding, and really painful mid-month bleeding. But all my smears would come back normal.
Of course.
They were like, it's not cervical cancer. And a lot of bleeding after exercise. And I'm not talking marathons, but like I run. But if I had a particularly heavy run or a cycle, I would painfully bleed after that. So I had GPs, I've shared this with you in email. I mean, I've had GPs tell me I had bacterial vaginosis was the reason for kind of pain and discomfort. I've had early menopause. I've had, I've had fibroids, but then no one sent me forward to look for the fibroids. Oh, they ask you, did you have anything before? It's probably another ovarian cyst because you've had one. I even got so far as people suggesting I just had really poor hygiene, and that was why I was discomfort down there, or that I was having sex with too many people at once was one of my favorite of all time. And that was picked up because on a questionnaire, when you answered, you had to fill in for a new GP, do you drink, do you take drugs? And I was like, no drugs, no smoking, but I have a couple of glasses of wine a week. And they were like, are you having sex with a few people at the same time? Because that will be really, hard on your vagina. And you just feel like going, I just go to orgies all the time. No, I'm just, there's something wrong. There's something wrong, and nobody.
Man, listening to that makes me sick, like literally sick to my stomach. That is terrible. And that's happening all over.
Yeah. But then the other thing I would say is, this was all a GP. I did once or twice mention, look, can I get a referral for a gynecologist? But because the NHS is quite different, and again, very importantly, you're not paying for the NHS.
Right.
They probably don't refer as quickly as soon as I got back here.
Yeah.
You pay, but you've health insurance, and they'll refer you if you want to be referred.
Right. So in all of this time, like all this is going on, obviously you're like between 17 and 26. And even after that, like, how is this affecting your day-to-day life? At this point, are you like, I know something's wrong in your gut? You're like, something is wrong. People won't listen to me. You're switching all these doctors. Are you getting by like normal day life, like enjoying your 20s, or was it more just stressful?
Stressful, yeah. And again, I'm trying not to kind of put too much, not blame Endo for everything now, but I really am a big believer that a lot of my anxiety, and particularly around your health, was kind of fueled by this. And not like I would have missed some work, not lots with this, because I do think as well, you just battle on and you kind of scrape together. I go everywhere with hot water bottles. Every workplace I've ever been knows I'm a girl with a hot water bottle under her desk. But I could do everything. God, like I've traveled the world and I've kept jobs and stuff. But I think relationships probably suffered. I mean, I'm with my husband 8 years this year, but I think the relationships definitely suffered, particularly with kind of the sexual activity end of things, or just maybe people thinking, Jesus, does this woman ever stop moaning? Because there's always something wrong with you, Elva.
Right.
Even my mum recently would say that she kind of was like, you know, I kind of used to use this phrase. I used to say, I'm telling you, someday there's going to be something wrong and you're all going to feel really bad about this. And now she's like, oh God, you know, it's not that we didn't know and support. But I mean, back to age-wise, this is right up, because I'm 36 now.
Yeah.
So 26 was when I started in the UK, kind of just about, but you know, this went on through those years right up until 36 this year, or certainly maybe 35. It was last year that I was just like, this is out of hand. It's so much more than other things. And the other thing was that this is a hard one to talk about, but I have calibrated my body to think that the way I go to the toilet is normal.
Yeah.
But it's not. And I look, you know, I don't know who I know who's ever going to listen to this or watch this, but hey, I may as well put it out there. Only recently, speaking to my husband, he was like, that's not normal. I just became used to it being normal, but I had to help myself go to the toilet. And that's really embarrassing. But I, you know, found my own way of using gloves and kind of lubricants, and I have evacuated my own bowels. And when you go to a doctor and you say that, or I like have to move around on the toilet an awful lot, and that was they were the failing doctors though, because I would have said that to some doctors and they would have gone, just a lot of people get constipated, and you're thinking, I'm not constipated. Because again, sorry, but this, you know, your podcast is all about being open.
Don't be embarrassed. People need to hear this. No, there's so many people that are embarrassed to talk about this, and you're not the only person I've talked to that's done this. So please, I mean, as comfortable as you're sharing, there's nothing wrong with what you did. You had to do it.
But that's the thing, is you know your body, because I'm saying to doctors, you know, what comes out is not hard and it's not dried up. It's not, I'm hydrated. It's that it won't come down.
Yeah.
And they'd be saying, no, you're constipated. You're constipated. You're not eating enough fiber. You're not drinking enough. And again, you just kind of go, oh, I'm not listening to this. So it was only last year that I was like, this is getting ridiculous. And I think age also played a part. I was like, I'm 36. I was conscious as well of my mum's history, having had hysterectomy in her early 40s. Conscious of my grandmother's cancer history. I was thinking, am I on a slow path to somewhere else? So through my GP here, I was like, I need a referral. And to be fair, she was a bit like, oh, she took my bloods and found that my progesterone was really low. And initially was like, yeah, we need to give you progesterone. And I was like, I'm not a doctor, but I was like, but why is it low?
Right.
I took it for a month and I was like, nah, I don't want synthetic progesterone and I don't know why.
Yeah.
And I went back and was like, I want a referral. So she pushed it forward. And that's how I ended up with surgeon I'm with now, who now he's a professor in Dublin and he's very lovely, and I totally trust that he's very respected and a great surgeon. He's obs and gynae. He delivered my sister's 2 babies. And he did that perfectly. So, and this is another thing you've mentioned before, I cannot find that there's anyone, bar one person in this country, who is, that's their thing is endometriosis.
Yeah.
He took me in, like, go on to my surgery.
Yeah, okay? Well, really quick. So you had the IUD in from 26 to like 35, right? Because you're 36 now, and you thought a lot of the problems were from that. Did that help at all? Just, I always try to is there any, I like to just see, like, did maybe give options to people who can't have surgery or something like that, or you just felt worse on that because it was in your uterus and your uterus was like, no. I think they put it in your cervix.
Yeah, I think what's really interesting actually when I think back is having it inserted was the most unreal thing I've ever had done. Like, they said it can be painful. And again, you know, I was like, well, you're just over the top. But I like to think I have a decent pain threshold because that's suffering. but my body just did not want that in there. So for about a week after I had it, I was having these like major contractions to get rid of it. But once it settled, it was invisible. Yeah, and see, mine wasn't hormonal, so it won't have been regular cycle, but it was definitely a great option if you don't want to take hormones, because I mean, now who knows? I would say, you know, could I have gotten pregnant anyway if it failed? I had blocked fallopian tubes, I had endo everywhere, so maybe that was, you know, another in part reason. But certainly, I never had a suspected pregnancy with it. So I wouldn't say don't go for that just because it didn't.
No, for sure.
And this is the thing, I went into surgery in December, and his initial consult was, one thing he was brilliant about was I explained a couple of things, and he just was like, stop. When did you ever think any of that was normal for a woman? And I was like, well, long periods, painful. And he was like, it is not normal to, because I would have said, like, I would rock myself, you know, in the bed. I go everywhere with a hot water bottle. He was like, do you think that's normal? So he was like, I'm taking you in. I want to do a laparoscopy. I want to take that coil out. Maybe it isn't great. I want to take a D&C, and I want to take all the tissue out of your uterus, and I want to have it analyzed. So that's what he went in thinking. And so I probably went in thinking, it's just this coil. It's causing all sorts of problems.
Did he ever mention the word endometriosis? No, of course not. Okay, so
yeah.
You agree to this. You're going to get the coil out. You're going to see what's going on. What happens?
What happened? Well, and it's so funny because I was listening to one of your guests this morning who had, I think I was kind of working and listening, but I'm pretty sure she said she had her surgery on April Fool's Day. I had my surgery on Friday the 13th of December. Never, ever have surgery on Friday the 13th. No, don't do that, because people have lots of operations on Friday the 13th, but I will never have it on Friday the 13th. What happened? So I went in, and the other thing is, you will become incredibly strong when you go through this. And I just love how strong I've become. It's one of my big things. I don't mind being full of it and saying I've become so strong over the last few months, because I was the person who couldn't even walk in the hospital door on my own. They broke all the rules and let my husband come into the pre-theater room, because I was like, I'm not doing this. I can't do this.
Yeah.
But I went through surgery, and when I woke up, I'm hazy, but he definitely said, you had a lot going on in there. He said, you had a lot of endometriosis. And I was like, I've heard that word before. I've heard it before. He did a D&C, he removed the coil. I had a double salpingectomy. I had one tube that was fairly blocked by a cyst. The other tube, that was my preference. I had my tubes removed from a kind of permanent contraceptive thing, and I don't mind saying that. I had a cyst on one of my ovaries, but he didn't need to drain it. It was small. I had a lot of endo, and then I had my ovary was bound to my bowel. My bowel was bound to my uterus. Everything was stuck together.
Yep.
And he had to separate my bowel from my ovary or bladder. And where he did that was in my lower rectosigmoid colon.
Mm-hmm.
Did say after surgery, I had to use this mesh, which dissolves over a few months. And it's to stop everything from sticking together again too quickly. So I came out of my theatre, and I went home, and it was coming up to Christmas week, and I was just so relieved I was alive, and that I just had this thing. But I thought it was like, you've had it and now it's gone. And he was like,
I want to pause right there, because I'm really happy that you said that, because it's such an important point, because I thought that too. I literally thought that every time I've had surgery, I've thought that, and it's only been in the recent year or two that I've realized that, unfortunately, that's not true.
I know, and the thing is, now in fairness, he was seeing me after theatre, you're on morphine or whatever, but everything that I've said to you, Connor, my husband, remembers too, so at least I wasn't totally dreaming. But he was like, it's Christmas time, go home, enjoy Christmas, I'll see you in 6 weeks. So I went home, and I felt really quite well. I came out of anesthetic fine, no problem. My wounds, even within a week, I was like, oh, these are tiny, they're gonna heal. And then day 6, I collapsed. Like I did, I was a proper collapse. I had been eating normally again, but I went into this unreal pain. A couple of days before that, I actually went to a GP because I thought I had maybe a urinary tract infection and I wanted to get ahead of it for Christmas because I was peeing blood. And I got the worst GP. I got this locum GP replacing my own. And it went really, really wrong because, first of all, I said to him, I have pain. I've just had this surgery. And I had like all my details. And he was like, I don't think you have an infection. I think you're just not tolerating your pain well.
Oh my gosh.
And then, and again, I know this is nothing to do with, you know, your podcast, but, you know, I had my self-injectomy by choice, and that's, you know, I've no problem with that. He was obviously, I mean, this is Ireland, things are still a little bit different. He obviously wasn't in agreement with that. And he said, who did this to you? And he asked me, had my husband been asked about the option to permanently sterilize me? So I knew I was with the wrong guy. And I probably should have pushed, but he didn't test urine sample, didn't test anything. So I walked away from there with just more diphenol, just like diclofenac. And I went home. And the next day I went into A&E, into where my consultant was based. And I spent a few nights until Christmas Eve morning in just the most horrible, horrible, horrible condition. I couldn't eat, I couldn't sleep. I was in most agonizing pain. I was writhing around in pain. And
where was the pain mostly? In your stomach, in your like pelvic area? And is A&E emergency room?
Yes, sorry, ER.
That's okay.
Yeah. We'll put a translation there.
It's okay. Yeah, no worries.
So yeah, I went there.
And you were there, so they admitted you.
Yeah, I was admitted because my heart rate was crazy high, my blood pressure was normal, my temperature was fine, so I didn't have fever, but they could tell, and then they ran my bloods, and my CRP, which is your C-reactive protein, which is an indication of inflammation, was like, it's meant to be 0, it was like 600, and they were all going, Jesus. So I was admitted, and I was put on multiple antibiotics to cover off possible perforation of the bowel because he did work on my bowel, but they did ultrasounds, there was nothing evident. I had no bleeding internally, but did they look for everything? I don't know. I'm going to try and keep this short, but I was about 9 weeks recovering from that. My platelets and CRP level didn't come down to the middle of March. I never fully got back to work. I was meant to be off work for like 10 days, 2 weeks. I don't remember Christmas, New Year's really. And again, I actually am a bit, sorry if it's evident, but I'm still a little bit shaky.
Of course. That's a very traumatic experience. It's okay to be shaky about it.
But it was more the weeks after because it continued at home. I was released home on more antibiotics and stuff. And then I went from ultrasounds to CTs. It was gastro, not gynae. It was gynae again. It was, it just took ages. But to be thankful of how that happened, I ended up in the following it's kind of 5 months since my surgery, having CTs, ultrasounds, countless bloods, but I also had a colonoscopy because at that point my surgeon by mid-January was like, I'm not ignoring you, but I don't think this is a gynae issue. I think you've had colitis in your bowel, even though we never found an infection. There was no perforation of your bowel. I kept quizzing the fact that he used the gel. I kept quizzing the fact that he had operated on my bowel, even though he didn't go into it. And with medicine, they rule out what you don't have before they do have. So we went on. I had a failed colonoscopy because, and the gastro guy said, I can't get around your rectus sigmoid colon. There's an external pressure. Now I know what that is, but he was like, there's something not letting me turn your bowel. And we were like, okay. So then I went forward for a CT colonography, which is like a virtual version. And when they got in, randomly, they saw a 7 centimeter cyst on my ovary, which made no sense because I was like, I just had a laparoscopy, a couple of months ago, and I have no symptoms of a very large ovarian cyst. And then they wanted to do an MRI to see what this cyst was. And I had that MRI done a couple of weeks ago. in the midst of all COVID. And by the time they did the MRI, this cyst has gone down to 2 centimeters. So that would suggest it's a hemorrhagic cyst where they bleed in and out. I also have one on the other ovary, but we're not worried about that. But what they did find, because I suppose MRI is this gold standard of imaging with endo. Now, only if they know you have it, right? Because they don't use MRI to just diagnose it, but if they know you're an endo person.
Yeah.
And what they've discovered is my pouch of Douglas. So that's your, I'm learning. I feel like I'm an expert now.
I know. Don't you feel like you're a doctor after all of this? I do.
Like, got my little badge.
Mm-hmm.
My pouch of Douglas is affected by endo. Now, my surgeon's saying that with a standard lap, they don't usually go looking down there. I mean, I read about other specialists and they're like, I go everywhere. I look at your thoracics, I look everything. But with a standard lap, they don't. So he was like, I wouldn't have seen that. But hey, oh my God, you have this endo down there. Oh, I left some in there. And the other thing I have is I have a nodule, I imagine it's a fibrotic area of endo on my bowel. Now, I don't know how he didn't see that because he was in working on my bowel. And it has caused a thickening of my bowel wall. And then the last thing I have is that I have a narrowed rectum from whether it's another nodule or it's just endo or something, I don't know. And it kind of suggesting that my rectum and my vagina are stuck together.
Yeah.
That was my like.
Yeah. Like, and you were like, I've been telling you since I was 17 that I had shooting pain, and that's probably why you had shooting pain. Because
yeah, exactly.
The nerves are freaking out because they're stuck together.
Yeah. And painful sex. Again.
Yeah. Yes. Yes.
How would, because I saw a really good quote the other day about adhesion pain. I think it's from a surgeon, and it was this, if you stitched a guy's testicles to his legs and told him to go for a jog, that's what you're talking about. And like that, if you think that you're, sorry now, but if you think that your rectum and your vagina are, they sit close to each other, but they're meant to move and they're stuck, and you go one place, that's gonna hurt.
Excruciating.
So that's where I'm at now. But the thing is, they're still very surgical about it, because now what they've realized is this is going to be actually a bigger problem than maybe even your endo before. Maybe this is actually the biggest problem you have, because you will end up with bowel obstruction. You will end up with bigger things. So tomorrow I have a consult to discuss my next surgery, which is now needs to be done. And it's between a bowel shave or a resection. Now, his gut feeling is more likely to be resection, because the deeper this is gone, because it's quite deeply infiltrated, you can't shave so much off because you just wouldn't be left with a strong enough rectum to that terrifies me. But what terrifies me more is the aftermath of the surgery in December happening again, because no one's ever been able to tell me what it was.
That was my question. Did they ever figure that out? Again, I'm not a doctor. My assumption is you either had a reaction to that mesh, or there was some potential bowel leakage. I don't know. I mean, again, I'm not a doctor. I have no idea, but those would be my...
should have been the writers for that. Remember House, the program? Because I'm like, we could have solved medical things. Because I'm with you. I'm like, it just had to have been an error. And my GP was brilliant. She was like, I'm not a specialist, but some irritant got into your system.
Yes.
And it can only be something that's naturally inside you, that's meant to stay there, as in something that came out of your bowel, or medical instruments, not realized. My money will be more on a bowel leakage than... The other thing I've thought about is, and I don't know, did I have like the mother of all flares after someone being in there?
Maybe.
I don't know. But now my concern is, what does it mean for the next surgery? Am I going to react that way? And how can they kind of guarantee that? How can I best prepare? They don't do bowel preps before gynae surgery here, or they certainly don't for a standard lap. So I went in with a full bowel. So again, like that, you know, I think a perforation would have been evident, but I think it must be teeny tiny perforation.
For sure. 100%. I mean, that's what your symptoms sound like too, because your body was trying to get rid of something. But people also have reactions to the mesh. I mean, I don't know.
And again, like that's why I'm on here, because I'm like, if I tell this and like someone got in touch and was like, I've been that person, I'd love to hear that, you know.
Yeah, no, and for sure. And we will make sure that if that feedback comes, I'll make sure that you get it. But my other question is this surgeon that you're seeing that you like, does he do excision or ablation?
Everything I had done in December was ablation. And the first time I mentioned excision, I hadn't actually even really read up on it myself, but I just knew there were these two words. Or I think, did he even say to me, now you'll hear people talk about excision versus ablation, blah, 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 but he definitely used ablation. I need to speak to him about this particularly tomorrow, because there have been so many rounds of discussion. It's never been the right surgical technique, but tomorrow is that, because I don't want anything but excision now.
Yeah.
And if it means I wait, and if it means we do have a health tourist thing. I could go to the UK, and there are some centres of excellence in the UK, but I don't know what the waiting lists are like, and I don't know. There's one surgeon in Ireland who confirms, and I've said this to you before, go figure, it's a woman. She does excision. She does work from the same hospital that he does, but again, it's a funny world, isn't it? You get a bit overwhelmed with these consultants, because you kind of feel, you know, going in and being like, are you the best guy to do this for me? That he might say, oh, thanks very much, you can leave if you don't want me to talk to you. So I feel like I've got to kind of tread carefully and just.
But you know what? There's nothing wrong with getting a second, a third, a fourth opinion, because when you're talking about the bowel, it's a whole different ball game. And you have a bowel surgeon in the surgery with you. And you know, you do not want your gynae, your GP, a general surgeon. You want a bowel surgeon.
Well, that's the thing. I imagine it would be a bit of a, because my case has been discussed twice now at these MDMs, these multidisciplinary meetings. Mm-hmm. So tomorrow is the outcome of that. And I imagine what he's coming at is saying, I'll need to go in and do this removal of the rest of this endo, and then I will have she or he with me, and they will do that. And if that wasn't the approach, I'd be stepping straight back out of the room going, no. Yeah. I mean, blessed in some way, my father-in-law, my husband's dad, was obs and gynae for years. Earlier in his medical career, he's a GP now in the UK, and he's been really good. And again, like that, you get so comfortable with talking about all sorts. I never would have thought that I'd be on the phone talking about consultation with my father-in-law, and even again, like painful sex. You think, oh, I can't even talk to my parents about that. But he's a doctor. But the first thing he said to me was, do not let anyone touch your bowel. Do not let anyone touch your bowel unless you know.
Yes. I couldn't agree more with that statement. And so I don't know if you know, but I did have a bowel resection in 2018. And most of the people listening know that I went through that. And it was a tough surgery. It was not easy, I will tell you that. But it had to be done. And I'm better now for it.
Yeah.
So
I think I think I've read sitting here with my book, my beating end that I read, but that term of one surgery done right, and I'm going to coin that phrase. I'll go in again tomorrow and be like, I want one surgery done right, or at least the aim of one surgery.
Yeah.
Because I kind of want to feel now that I know this is chronic. I've learned that. I know this is with me lifelong, or certainly until you stop producing estrogen. But I kind of feel like it's not enough to just surgically approach it. Like there has to be other things. And the other thing I found as well is I have always had a crazy weak core and pelvis. I'm not an athlete, but I'm fit enough. I run kind of trail running longer distances, not at the moment, but it's taken me a while to come back. I like cycle, I like swim. I think I'm fit enough. I can, bench press and stuff like that, pretty big weights. Sit-ups, anything. I just think I have no pelvic floor. But it's been probably bound together the wrong way for years.
Yeah.
And I've had friends of mine who, couldn't run 100 meters, but they just look at me when I can't get myself up into things like sit-ups or just particular core movements. And they're like, are you actually like, is there something missing nearly there? So I think I want to ask about pelvic therapy, physical therapy, and just things like that. Because I kind of feel at the moment, symptoms-wise, and this is the big thing for me, I'm worse than I was before. I'm better in terms of my cycle. I have a period that lasts 4 days. I want to put that out on posters outside my house, because I didn't know you did that.
Yeah.
They have been bang on time, 28, 29 days since January, and they're light. So I'm so thankful for that. But my bowel is worse than ever. And the rectal pain it's amplifying. I'm conscious as well that with COVID going on in the world, I think we're all hurting a bit mentally, and I'm aware that sometimes pain is felt more when you're emotionally tired too. But like, I was out for a jog the other day, and like, I'm stopped. I can't go on. I can't move, and like that. My husband's kind of going, I don't know what to do. Can you walk on? Do I have to get the car? Because I'm like, I can't move. So my bowel is worse. I'm not going to the toilet unless I help myself, which I finally admitted to some people, and they were like, Jesus. And another thing is, I am crazy hormonal. Like, PMS is worse than ever. And again, another thing, in case anyone's had this happen too, in terms of maybe the mother of all flares, in the midst of all this as well, like 6 weeks ago, I found a breast lump, which thankfully is normal. It was a cyst, but I can't help but think, what is going on with my body?
Right. Your hormones are kind of all fluctuating and up and down since that surgery. And yeah, and everything you're saying is I'm so sorry you're going through all this, because you're in it right now. And I know exactly where you are, exactly how you feel. And I wish I could just come there and hug you, but you're doing all the right things. And the other thing that like we haven't even talked about, or that you haven't even factored in, is you found out you had this diagnosis. You really didn't even know what it was. You went in for this major surgery. You had some complications afterwards. I mean, have you even had enough time to absorb what it really means? I think you have, because I liked that you said that you think it's like it needs to be treated multiple ways, and surgery is not the only way. It took me years to realize that. Like, you have to change your diet, unfortunately. This is a systematic disease, and surgery isn't the end all be all. It helps, but pelvic floor, taking care of yourself, eating right, drinking water, all of these things, acupuncture, are things, unfortunately, that we have chronic illness that we have to maintain. Like, obviously you've had to absorb all of that in the past couple months. How are you doing with that mentally?
I'm, again, being an anxiety person all your life, you're really good at wearing a mask, but I'm not great. Like, and again, I'm conscious that like the world isn't great at the moment. So I've got to give a little bit, don't blame it all on this, but I'm not. And there is that weird weakness thing as well, that you're so happy. You're like, I have something, but then you're like, I don't want this thing. I don't want this.
Right.
Right. I feel a little bit empty as well. I feel like, I don't know. Yeah, it's a really good question. I think I'm answering it. I'm still going through this. No, yeah. I'm on a journey. But I think biggest thing for me right now is support. And that has been a bit tough, because it's, without sounding like you're moaning, it's making sure that some people who didn't know actually do know. I'm kind of sitting them down. And only about 2 weeks ago, my sister, who's my best friend, I just texted her going, I'm not okay. I'm not good. I'm so annoyed. I'm so annoyed with all these doctors sending me in circles, and I don't know what to believe is true, and I just feel awful. And she was just like, I didn't know. I thought I was trying to be stoic and be like,
yes.
But I think the biggest thing for me now is to learn the right information. And what I did was do a load of research, and I did a lot of following people like that on Instagram. I found you, and what I've done recently, though, was I've cut back on that, and I cut it back to a couple of sources I really trust, because what I found as well was I found some people, and it's no fault of their own, but they're so obsessed with this and educating people correctly that they're letting anger slip in. So I'm not going to name names, but I followed a great page recently, and great tips and the right source of information, but then picks up when they see people on the internet who say the wrong thing about it or challenge it, and screenshots their responses and says like, how stupid is this person? That's just mean. And just stop. And I think actually I sent you a response to something you posted one day, and it was in response to this. It's stop and use that energy. It's hard, but use that energy to get in touch with that person and say, I'd really love to talk to you for 10 minutes and just explain what this is. Calling someone stupid, and so I was like, oh no, I can't do negative. I've went back to a few key people, and that's what I use. I'm reading. I've ordered some books.
Good.
big thing is being organized. I'm laughing because I'm sitting here and I'm ready for my doctor's appointment tomorrow.
It's, you know what? It's huge.
I forget we're on camera, but if you're listening and not, I'm sitting here with this beautiful folder, and I bought multiple folders because I couldn't decide which one to use. But it's hilarious. When the last went into the surgeon, he was like, "Now remind me, we had a CT done," and I just handed him this piece of paper, and he was like, "Whoa, that's organized." And I was like, "I mean business."
Yeah.
So I'm just, tomorrow is kind of a landmark for me. We'll see what comes out of that. I kind of feel like he did say he wanted to do this sooner rather than later, but with COVID, he would push it back as late in the year as possible. We've done really well in Ireland with COVID. It's still around, but that's not going to change. And so I kind of feel there's going to be COVID in hospitals next December, January, February.
Yeah.
If he wants to do it in the next 3 months, just do it, because I don't think I'm ready to mentally wait much longer than that, because
because you're in pain. You're in pain.
Yeah.
You don't feel good. You're struggling to go to the restroom. I mean, I understand exactly how you feel.
Sorry, because this is one I'd love. I never had the major endo belly thing before. That was one thing I escaped since December. It's crazy. Like it's not just, you know, I now know what people mean. It's not just a bloated stomach because I ate too much. I can go multiple times a day up and down, and I can go. One thing I've already had, I have a big bottom and big hips, but my stomach will be relatively flat, and I can be like 5 months pregnant, and it's rigid.
It hurts. It hurts.
But I don't understand how it goes up and then it goes down.
I don't either. I still haven't figured that out. And, you know, going back to like even what you were saying about like people on Instagram and positive and negative, nobody understands this disease. And if anyone wants to listen to a medical expert say that, go listen to my podcast with Dr. Nicholas Fogelson, because I agree, like, don't fight about it. There's a lot of misinformation. Look, I thought it was an autoimmune disease until 2 years ago. My fault, but there's no point. We don't know.
Autoimmune, you're like,
But it's not, but they don't know. Nobody knows everything about it, or else we wouldn't be in these positions that we're in, because they're still learning about it. So I really want to stress that too. Like, not everybody's right. Do your research and then trust your gut. Again, I always say that on like every podcast, but it's true. It's never steered me wrong. It sounds like it hasn't steered you wrong. You kept fighting to get the care that you deserve, and being organized and advocating for yourself with your folder and cute folders, whatever colors you want to have. But the only way, unfortunately, I know it's upsetting, but that's the only way that we're going to get the care that we deserve. We have to fight for ourselves. And you can't worry about hurting a doctor's feelings. You have to worry about yourself.
No, and one of my good friends in the UK, she's an oncologist. But I kind of went to her recently, and first of all, she was like, "Oh man, you're being sent in circles." Also, I was like, if I arrive in with a folder, or if I arrive in with like 20 questions on a page, what would you think? And now she's one of my favorite persons in the world. She's like super organized, but super disorganized. And, you know, I can imagine her kind of loving both sides of that world. But she was like, I love it. I love when a patient comes in, even if they're pretty abrupt, and is like, you are my doctor and I need answers from you. So I was like, okay, I've got like the doctor's permission to go and do this. But Ireland is hard. And again, I've become a member of the Endometriosis, I can't even say the condition's name, Endometriosis Association of Ireland, but it's a small group. It's teeny tiny small. It's like the lady who is working on it at the moment, when I said my membership, was like, I'm a frontline worker, and with COVID, I don't get time to like answer emails. I was like, Jesus, this is so unsupported in Ireland.
Yes.
We have, like you say, very few doctors. And I won't lie, again, I doubt he's going to listen to this podcast. No offense, Melissa, but I'm wary not to say that I'm not 100% happy with him. But I'm not. I definitely need more confidence from him before.
And that's why you need to go in with all of your questions. And if he doesn't answer them the way that makes you feel comfortable, then time to move on.
Yeah. But I mean, I think like the biggest thing I've learned with this, and I said it earlier on, because again, like that, I would have been someone who, I'm not a wuss, but I would have had a health anxiety thing for a reason. But before now, I would have been kind of always brought someone to appointments. But like I said, I've been for CTs, MRIs, mammograms, I've had injections, I've had all sorts. I ended up in hospital, and at Christmas and a couple of nights. You will just you'll just learn how strong you can be through this. Maybe not everybody, and it's definitely surprised me. And like my support network are like, you've come on so much. So I'm also trying to use that, and I'm like, channel that now. But also not let it kind of take over, because again, listening to your guest Lisa from a couple of episodes ago, she had to take a break, and she was so right. And I can see that maybe even after this next appointment, if there is a surgery scheduled, I'll be like, media silence on this. Yeah. Okay, watch your diet and take care of it. No more Googling, and because I've Googled bowel resections, and you'll know.
Yeah. Don't do that. Don't do that.
And I'm already sitting here with a stoma, in my mind. And which is, unlikely to be needed. But again, I'm like, so I'm going to take a break. I'm going to do the appointment tomorrow, and then I'm going to take a break. It's summertime here, and I'm just going to take a few weeks to be like,
yeah. And even when you take that break, your intuition will tell you too what needs to be done. And there's nothing wrong with taking a break. And and after my first ablation, just so you know too, about 6 months after, I felt worse. Because I think,
what is that? Can that be? I mean, I'm so glad you said that, because I have Googled the term worse after my first surgery, or worse after ablation, all those different combinations. And I can't really find loads of people who said, I got worse afterwards.
Most people, I mean, I've met people that it worked for too, so I don't want to rule it out, but I will say that most people that I talk to, they do feel worse after. And again, not a doctor, none of this is medical advice. My only assumption is they're in there and they're burning off the top layer of the endo, and then the endo gets angry and you have more inflammation. My only logical thought is that you're more inflamed, and everything's even like you came in here and disrupted it. Like I was already angry, but now I'm really angry. I don't know. That's my assumption.
Yeah, and I'm totally with you on that, and it makes scientific sense to me. And I don't know huge amounts, but I know that inflammation is set in pathways in your body, and if you have pathways kind of crazy firing, it does take time for that to calm down.
Yes.
But you need to be supported by, even if it isn't drugs, something. And I'm a big believer as well, and again from Amy Stein and Iris Orbuch's book about this upregulation of your nervous system. I've noticed that at the moment, I don't think it's fair to say I'm feeling pain more, because then people put this assumption that you're emotionally feeling it, and there's not pain there. There's pain there, but I do believe that if your rectum and your vagina are stuck together, you've got tissue now connecting them, and that tissue has nerve endings. You have more nerve endings to feel more pain stimulus. And so, but I'm kind of conscious that my nervous system is probably crazy upregulated. Yeah. And again, and the theory in their kind of book as well is never do that excision until you've at least tried to take that down. So another question to him is, how do I get myself just a bit calm down, and what does he suggest? And again, using his response to that as a bit of a temperature check to be like, this is the right person.
Yeah, I think aftercare of endo after excision is one of the bigger problems that we have, because these surgeons just do the surgery and then they're like, bye, good luck. And there's no aftercare. I don't even know if there should be aftercare centers. I don't know the answer to that, but there has to be something, right? Because right now I only find out about aftercare from the endo community that's listening to this. I never thought of acupuncture or any of those things. I learned it from other people in the community teaching me. There needs to be some sort of try this, try that structure, but the doctors don't provide that. At least none of mine have.
And I found it really interesting as well, so I get say that a cesarean section, it's a huge incision. And I know with laparoscopic surgery, it's minor incisions and it's minimally invasive. But to me, I know people who've had at least a consult or at least leaflets about physio after you have a cesarean, where you've had organs moved around and you've had, it's more about the incision. But I'm like, how can you go into someone, and especially say with my surgery where he's going, I had to unglue your organs from each other, and I also had 3 little incisions in, and every surgery causes potentially more adhesions, and I moved that's the other thing, he did say that he had to move my bowel to not like the other side of my body, but he had to move it a bit to keep it out of the way. And no one thinks Now, how is their core going to just get back to normal with that? And even a basic leaflet that goes, you'll probably use this as a napkin next week, but here's 6 exercises that you can do every day.
For sure.
Yeah, and there's none of that.
None of it. And even, I've never done pelvic PT, and I've had 6 surgeries, and just listening to some doctors, they're like, I recommend it for every patient I have. So, there's a long way to go. We've gone a long way. There's been a lot more awareness, but I think there's a lot more, and I'm really going to be thinking about you tomorrow and wishing you the best of luck with this appointment, but just trust your gut. I mean, is there anything else you want to add before we wrap up?
God, it's really hard because I've thought about saying this, and I'm going to say it, but take it with a pinch of salt, because okay, we can't all run into doctors when we're 17, 18 going, I think I've got this major condition, not just endometriosis, but anything else. I think I might have MS and stuff, because doctors have to work on deductions. So you don't have this. And we can't all run in worried we have every disease. But I can't help but think that, again, just know that it's not normal. You shouldn't ride around in pain, maybe 1 month or so a year. But if you have rectal pain, if you have that, especially when you're young and you've become sexually active, but it's not just that it's your first time. If someone is not able to actually insert themselves into you without you screaming, or just it not happening, none of this is normal. So don't go diagnosing yourself immediately, because that's the other thing. Don't go giving yourself conditions that you might not have, but listen to podcasts and build the case of what you have, or reach out to the likes of you, because you've been great help to me, and just find a good doctor. Again, if you're somewhere like the UK and you can't change your doctor, I don't know what to say, but maybe spread that case that you want to speak to someone else, and really push for a referral, because worst case you get to a gynae and they're not an expert in endometriosis, but they're going to be more of a gynae expert than a GP. And that's no insult to a GP. That's my last thing. I have been sent around the houses by people on ultrasound saying, you've got a calcification, it's due to surgery. I've had people say, you've got this. It took 5 months of specialists to get to the bottom of what they think is wrong with me. But it's not because they're not competent. They're not trained in that area.
Yeah.
That sonographer who did the ultrasound looks at babies and ovarian cysts and stuff every day. They weren't maybe used to seeing fibrotic endometriosis.
Yeah.
Part of me was like, I'm so angry with that person. And then I'm like, wait a minute. They're not. They haven't had that training.
Yeah.
So don't give up when you have a scan that says you're fine. But yeah, don't throw yourself into diagnosis. Wait, but just talk it out with people, and jump on the internet, because it is brilliant. But don't Google the hell out of yourself, because you will just have sleepless nights. I think it's just, again, you've hit the nail on the head many times. Trust your gut. It's not all wrong, and you're not a hypochondriac. You're not, because if you're feeling pain isn't generally you haven't made it up in your head. You're feeling something.
Pain is not normal. And that's the bottom line. And when you know something's wrong, something's wrong. And when people tell you it's normal, but you still know it's wrong, keep fighting, keep pushing. And that's the best advice that I can give. And then take a break. Like you said, if it starts to get too much and it starts to get overwhelming, take a little bit of break, step back, and the answers will come to you. They always do.
But I think as well, just confide in that one person as well. And what I've learned from this is that you actually can talk to people about embarrassing things like that. I mean, I'm now going to be on the internet talking about helping myself poop. But
there's a tool called, I think it's called I'm going to text you a picture of it. But for anyone who's listening, I think it's called the wand or something like that. And it's designed to actually open up your anus to help release.
But you know what's brilliant? In the last week only, I have connected accidentally with someone who, she's local.
Yeah.
Put something out there about I just saw that she was just struggling with her bowel. And I got in touch with her going, look, I don't know what your condition is, but this is what I've been doing because I've had issues lately. And it turns out she's a cystic fibrosis sufferer. So, I mean, that I pale in significance to that. But she actually came back to me and was like, you actually helped me. She'd been in hospital with an obstruction. and they sent her home with the crazy laxative and everything. She's like, some of the things you told me to do. And now I find I'm talking to her and I'm learning about cystic fibrosis. And she had a radical hysterectomy for cervical cancer as well last year. And it's like, there's lots of people out there who just don't mind talking about pooping and they don't mind talking about their body. So if it is that you can't talk to your mother, your brother, your husband, your boyfriend, there's probably someone like me. If you want to send me a message on Instagram and tell me how you're pooping, that's fine. Go for it. I don't mind.
How can people find you on Instagram if they want to talk to you about their poop?
I'm really bad at social media. I think I'm private, but I think you can find me. I'm Donnirl. But my name is Elva Donnelly. I'm in Ireland. I mean, if you can Google me and find me that way, I don't know. But Donnirl. Or if anyone asks you, again, by all means, connect them with me.
Yeah, I will for sure.
He's been being honest. He's been like, and he's like, God, you never stop talking. But it's the one thing in life, he said, I hear you. You need to talk. Keep talking to people.
I agree with that statement. Keep talking to people. If you're comfortable about it, keep talking because you're going to help. That's how I started on all of this. I was very scared to talk about it and open up about it. And as soon as I did, it really started to help people. And I had no idea. Like I was just like, 2 people will listen to this podcast. And it's actually it's just not true. And that's what fuels me to keep going is it's actually helping people. So thank you for coming on, sharing your story, being so brave, because your story is going to help so many people.
Thank you so much. It's been brilliant. It really has. And again, you've given me another goal in life. There you go. I've been on a podcast.
Check. All right, Elle, thank you.